actually recognize the effect of the early childhood changes as much as we should have. So I think this might be what it is.
It's really interesting for next year.
Yeah, okay. Thank you.
Thanks to Will and to Liz and Eileen for giving me an opportunity to speak at this forum. And special thanks to Rajan and Saito and Sunita. I guess I'm kind of more the analytical person here. They're the ones who've been doing the groundwork and getting the survey together and the data set per se. I'm from Duke-NUS Medical School for the Center for Aging Research and Education. I'm talking about Kerala, India, which is a relatively unique state in India in terms of its demographic profile, in terms of its literacy status, and therein talking about active life expectancy and differences by social class. And I'll get to social class part in a while. So that's the introduction, a bit about health expectancy. I guess that's an introductory slide. I don't think I need that for this audience. And then I move on to some demographics, what is known about health expectancy in a short slide, and then kind of mostly social class being treated in this context as caste or tribe or social caste, not simply just socioeconomic status, and then kind of the regular sections of the paper. So kind of just briefly, kind of there's life expectancy, which most of us have been talking about, and then Colin, of course, talked about the health expectancy part, the disability, and the with disability life expectancy. And of course, then you have the absolute and the relative terms for both of them. And there's increasing interest globally in tracking not only life expectancy, but health expectancy, both for kind of assessing the population, tracking it over time, and comparing across populations. So Kerala, that's India. That's the Indian map. And the Pakistani map is slightly different, but I'm from India, so that's the Indian map. So and that's Kerala there at the bottom, and it's kind of landlocked at the top, and then there's kind of the ocean down south. So that's Kerala in terms of indicators. So the second column is more kind of the Indian indicators for the overall for India, and then we have the indicators in Kerala. And if you see, for most of kind of the indicators that indicate development, it's doing really well. It has the lowest IMR. It has the highest literacy rate for both above 60 years. And here literacy is from the census. We define ability to read and write with understanding. So that's the definition. And then the life expectancy from the latest life tables is around 74.9 years, the highest for Kerala and the second highest at 60. Interestingly, the highest state in India with life expectancy is Jammu and Kashmir now. So except for birth, they have the highest life expectancy at every year because IMR is high in Jammu and Kashmir. So that I guess is kind of surprising, but it's kind of overall doing quite well. So that's the story. And in terms of population, India is relatively young. I would say it's around 8.5% of the population is 60 years and above. Kerala is relatively older compared to the rest of India, 12.5%. But of course, India is the second most populous country, so you have 104 million older people living in India. However, kind of health expectancy research in context of the elderly has not really kept pace with the magnitude of the elderly in India. It's relatively sparse. I would maybe place a wager on it, less than 10 peer-reviewed publications, I would say. Solely from India. I mean, it has comparative work that's done by big groups, but solely kind of from India. And most of it is more in conference presentations rather than peer-reviewed publications. And most of it is interestingly from Kerala, thanks to Saito partially. They of course define health in different ways as is an issue with a lot of health expectancy work, for good or for bad. And most of them just utilize the Sullivan's method because of lack of longitudinal data, and therefore they're restricted to calculate health expectancy by the life tables, which are usually available by gender, sex, or by place of residence. So in terms of other socioeconomic indicators, that's usually not available. The caste system, if you're not very familiar with it, so it's something that has been around in India since 3000 BC. There was a guy called Manu. He wrote a book called Manu Smriti, and that kind of laid out how you should behave in public. It was kind of, and the whole concept was that you develop from God, and those who came from the kind of the brain of the God are the Brahmins, the kind of the upper castes, and then people who are kind of going down to the feet, and those who are kind of didn't really come from God, who are the outcasts. And that has been around for a while for sure, and it has dictated hierarchy in the population. It's a closed system, you're born into it. And you kind of, and where it's very strong, you're kind of labeled for it once you're born into a particular caste. And interestingly, it hasn't really gone away. So the CEO of Infosys, who was previously on the governing board of SAP, he is now being cornered in India for some kind of reasons. He's Indian by descent. He's an American citizen now. And in his defense, he said, no, I am a Kshatriya, the second caste there. I will fight against all this. So interestingly, he had to kind of bring his caste into the whole debate, which kind of points to that. I mean, I don't know, he makes $1 billion or something. But then he had to bring his caste into the whole debate, which is kind of interesting as a point. Of course, I mean, it's not, and it has kind of toned down over time. It was much more ingrained in the Indian society, say, before independence. After independence, at least the constitution banned caste discrimination. There's affirmative action for what is called as scheduled castes. I'll just call them SC for short, giving them quotas in government educational institutes and government jobs. Simultaneously, there was recognition that there are indigenous groups of people who, say, live in isolated communities, mostly in the forested areas, in the northeast and other parts of the country, who have their own language, their own culture, their own rules and regulations, and mostly socioeconomically deprived. So they were recognized as scheduled tribes. And then the last one is more political. Around 1990s, there was a big political movement. People said, well, I want a job now, so let's raise an agitation for my community to be recognized as an other backward class. So there's a third group called OBCs, and in some states, so most of these the SC would be mostly Hindu by religion, but the other backward classes, interestingly, also in some of the states, including Kerala, all Muslims are classified as OBCs, and most of the Christians are classified as OBCs. So there's kind of an interplay between religion and kind of denomination, etc., going on. So that's kind of the overall background of how social class has been. In terms of research, not much, but there have been few papers coming out, mostly from S.V. Subramanian's group over at Harvard, taking cross-sectional national data and linking it with health outcomes using the NFHS, the DHS data sets. And they've seen that if you belong to a disadvantaged caste, mostly an SC or a ST caste, then you're more likely to have disability, defined variously, mortality, more smoking and alcohol consumption, anemia, childhood undernutrition. But at the same time, you have kind of lower odds of chronic diseases, and that's based on measured variables, so not self-report, because of course the socially advantaged ones have more access to healthcare, and therefore they might be more likely to report if you just ask. So, but even based on objective measurements, they have higher diseases and they have lower access to healthcare. So that's kind of the overall situation. So given this overall context, Kerala is an interesting state to study all this. First of all, it has a highest life expectancy at birth, and the second highest now at age 60. So people are living long enough for us to study this interesting phenomena there. Is there any difference by caste? There has been a strong history of the caste system as in other places, and currently there is social stratification by caste. There are around 80 SC, ST castes, around 85 OBC castes, and the rest which are not listed. There's a formal list that's available on the website. The formal, if you're not listed, you belong to what is called the general. Sometimes they call it the forward caste, which I disagree with, but they're called kind of the general caste. It has been a state in which there has been a long history. So it has been the only state where a communist government has been in power since independence, given a few years here and there where the Congress came in. But it has been largely communist and very kind of social in outlook, and therefore it has had egalitarian policies, whether it's translated to the ground or not. And therefore, if you find any differences by caste in that state, it's like a canary in the coal mine, then you're likely to have bigger differences elsewhere. So that's why it also kind of is an interesting place to study it. And of course, there has been this affirmative action in terms of literacy, education, jobs, etc. for a long time. So does this still play a role or not? And the final reason to study is I have data from there, and longitudinal data. And I think now LASSI, of course, will have national data. But other than that, I'm not aware of kind of big statewide longitudinal surveys of the elderly in India. So the primary aim that we have here is to assess for differences in various aspects of life expectancy and health expectancy by caste among older people in Kerala. And I hypothesize that at age 60, those who belong to the disadvantaged social castes will have lower life expectancy and lower absolute life expectancy, but also lower absolute inactive life expectancy because they have lower access to healthcare, therefore they may die early. The secondary aim is to see if the differences are maintained across sex and education. And I'm particularly interested in education and before, so I got the education data at like 4 in the morning. So I didn't have it till now. So my thought was, as you become more educated, the differences will become lower. I mean, that's the whole point of giving kind of reservations and making people go to school, preferences and reserving quotas in schools. The data that I use is called the Kerala Aging Survey. Started in 2004. 4 waves have been conducted since, every 3 years. The 5th, I understand, is just going on. It's a statewide survey covering all districts of the state. The foundation was by Rajan and Zakaria, who did the Kerala Migration Survey. And in that, all the 10,000 households that were covered in 2003 in the Kerala Migration Survey, because there's a big chunk of the population that migrates to the Middle East for work. And so that was the primary reason for that. But they realized there were a lot of elderly who were left behind. So then they approached these elderly and they were enrolled in the first wave. I don't have a clear sense of the response rate. It's above 90% from conversations, but I don't have an actual number about how many of the KMS folks were converted into the KS respondents. So at baseline, there were 4,940 respondents, majority being women as expected for individuals age 60 and above. And that's kind of the pattern. So there were people who were followed up and those who were interviewed, those who died, and then who were untraceable for that round. And then in the next wave, the untraceable were we tried to contact them again. So some of the untraceable then moved to the interviewed part. So it's not that they were forever lost to follow-up. So instead of lost to follow-up, I'm just putting untraceable for that wave. So that's the overall distribution. These are not final numbers. There may be a few changes here and there. I think we're still kind of cleaning up the final data. So activity was defined based on ADLs, ability, self-report of assistance or no assistance in 5 activities of daily living. That's the caste distribution. The overall proportion, if you see the SC/ST proportion in the general population in Kerala as per the census is around 11%. But here it was around 3% 2004, so there may be some underreporting going on. And then we have the other groups, and then we have the general category, which is kind of close to what is expected. And there was a big chunk of people called other Hindus, which I suspect includes the SC/STs and the OBCs who haven't really reported the race. And also we talked to Rajan and he said they only coded the major castes. So some of them were just put as other Hindus and not really coded. So for the primary analysis, I just put them under SC/ST and OBC, although I ran some analysis just excluding them and the results were more or less similar. And their estimates, if you treat them as a separate group, are also more close to the SC/ST OBC group. So that's kind of the overall distribution. In terms of education, the 20% is close to what is reported for 60 plus in Kerala. Around 79% are supposed to be literate, so that's close. And then you have the primary and more than primary. The classes within more than primary at the upper end are really sparse. So I'm not able to give more details within that. So and also kind of for estimates, I think at least 1,000 seems kind of reasonable for getting reasonable confidence intervals. I used IMAC and on the primary aim just estimated by social caste, and then for the secondary aim by social caste and gender, and by social caste and education. These are the baseline characteristics, wave 1, in terms of distribution of some characteristics by social caste. No major difference. I didn't formally test for statistical difference, but no major caste difference by age or gender or active health state at baseline. But there was a decent education difference where most of, I guess, despite the whole literacy situation or pro-literacy movement, there is a big chunk of the elderly who are kind of the SC, ST, OBC elderly who are illiterate versus the general, and then the primary ones is more or less similar, but then the difference again shows up beyond primary. Some transition probabilities, no significant differences at any age, so the confidence interval completely overlapped. But as expected, active to inactive goes up by age for both groups. You don't see the dot or the square, they're overlapping. The transition from inactive to active, the point estimates are higher for the general people of the general caste and lower. So transiting back to an active state once you're inactive seems to be lower for those who are belonging to the disadvantaged castes, although not significant at any age. That's active to dead, slightly higher point estimates for the SC, ST, OBC group, and the inactive to dead, again, higher estimates for, as we had kind of thought that there was kind of greater mortality among SC, ST, maybe because of lack of healthcare access. So summing that all together, there were no transition probability differences, but there were differences when you sum it all up. So life expectancy was around 2.3 years lower among the SC, ST, OBC group. Active life expectancy was lower. Inactive life expectancy was lower, and the proportion, interestingly, was the same. And so most of the difference is being contributed by the active life expectancy part, I guess. And that's kind of the overall picture. So then we wanted to, I guess, assess by gender, and I guess what was really interested in is education. So the gender part, the differences are maintained kind of in a similar magnitude for both men and women. Across kind of genders between, I mean, amongst, if you just limit yourself to the SC, ST, OBC group, then women have higher estimates. As expected, women live longer and also have higher active and inactive life expectancy. And within the general, you see the same pattern. But within a certain gender or sex, you find the same difference. The next one was where I was really interested in, does education matter? And it doesn't seem to be. I mean, for each of the three education categories, the differences are maintained. So I was thinking that for the lowest group, the differences would shrink and they would more converge to each other because literacy would kind of maybe take away the social disadvantage that is brought to them by their caste. But it seems that it is maintained across, I mean, and not really significant, but the difference in the point estimates is more or less the same for all the groups there. So that's kind of a quick summary. So there's some difference in point estimates in terms of transiting to death, higher for those who belong to the SC, ST, OBC social castes, and lower life expectancy absolute estimates, active and inactive life expectancy. Slightly higher proportion of active life expectancy, but the differences are really small there. And kind of contrary, I mean, gender, I didn't really have a hypothesis going in. Education, I thought education would really bring the differences closer, the two groups closer to each other, but they were maintained out here. So it's in line with our primary hypothesis, and we see social caste differences still being maintained. I would say, I'm saying relatively egalitarian now because, I mean, the policies, yes, it has been largely communist, but if you look at income inequality indicators, Gini coefficient, etc., it's not really very different from other places. And increasingly, there's more industrialization and income inequality coming into Kerala as well. And education also kind of help, but I think maybe I'm aggregating it too much, but the data doesn't allow me to disaggregate the education further at this particular point. Limitations, of course, SC, ST, OBC is a very heterogeneous group at this point, but the SC, ST numbers were like 197, so I can't really estimate them separately. The inclusion of other Hindus into that group, as I said, I did exclude them and ran the analysis and then made them a third group and ran the analysis. And their estimates were very similar with the SC, ST, OBC group. And the relatively narrow definition of activity, we just limited to ADLs at this point, did not expand it for now. And of course, there is the survey-related issues, there's loss to follow-up. Mortality is just based on the survey. There is no formal mechanism. So all the life tables and other estimates in India through the sample registration survey, there is no kind of formal registry for births and deaths kind of overall at a national level which you can really access. And of course, at this point, I'm just considering caste and education, but of course, it will be interesting to see in further work, and especially after listening to Cheeson tomorrow, maybe trying to employ space, maybe to see controlling for other covariates, do these caste differences still persist? Things like wealth, income, occupation, which we have some data on, as well as migration status of the family members of the older person, because a lot of them kind of send back money back home. Strengths, I would say it's kind of it's a statewide cohort of the elderly in Kerala, and till LASI data comes in longitudinally, it is one of the few longitudinal data sets in India. And we did an estimation by social caste, which is usually not considered. I mean, there have been only few papers that consider it, and in India, it's one of these axes of social stratification in addition to wealth and occupation. I think it should be kept in mind. So thanks for bringing me here. Just a plug for a conference we have in Singapore next year on resilience. It's by ABRU. So if you're around, please, we'll send you emails. That's my address if you have any questions. Thanks.
So this is great, and I have a lot of thoughts because I'm working on something similarly, and I have the similar thought that not enough people are looking at social caste differences in mortality. So two things in SCST. I think the way the Indian government classifies it is SCST overrides religious denomination. So even if you're STST and Muslim, you're still STSC for the sake of their classification. So I think that might make your proportions more in line with what you're seeing from representative data. Because you had, I think, higher Muslim percentage there than is actually in the states.
So in Kerala, interestingly, all Muslims are OBCs.
Oh, okay.
So in Kerala, the OBC list says Muslims. So if you're a Muslim by religion, you automatically just enter the OBC list in Kerala.
Okay.
So these are kind of, I mean, there's a central list, and then each state has its own list. So some of them are very kind of state specific in a sense.
Okay. So I think.
Yeah, I mean, it's intertwined with religion for sure.
And I think breaking out ST, SC, and OBC is really important because at least at the national level, there's a very clear gradient between the three. It's not like they're closer to ST or closer to high caste. It's almost they're directly in between the two.
Yeah, because OBCs are, I think, I mean, if you look at some of the OBCs in like Punjab and Haryana, they're kind of relatively rich, privileged classes who are more politically savvy, political mileage, they have the links, and so they're kind of more political reasons why they've been classified as OBCs rather than any social reasons at this point.
I think that might be suppressing some of the differences that you're seeing.
I agree with that. I agree with that.
Break that out, I think you'll find a much larger gradient between the SC, ST, and the other.
I'm just curious what we know from a broader set of countries about race ethnicity differentials by education. In the US, there's a literature, and education isn't necessarily all that protective in narrowing differentials for African Americans. In fact, it can be very stressful to that portion who gets sort of elevated.
I mean, I agree with that. And anecdotally, having studied in India and having friends who were from kind of classified, I mean, you kind of repeatedly reminded on a nearly a daily basis in medical school that you belong to that caste, and that can be very stressful.
Yeah, and the education is partly beneficial by the sort of social networks, and you know, if you're the non-minority caste or the higher castes are going to have more social capital to be able to take advantage of that education. So I'm not sure that I would have come in with a strong prior that this is going to narrow it, but it would be useful just to see there must be more work from other countries that have looked at this. I just don't know.
Thank you, Rahul. Thank you very much.
Well, thank you very much for inviting me to this workshop, and I've been enjoying the workshop yesterday and today's presentations. And my talk is this as educational gradient in Japanese mortality changed over time, and actually this is just still. I mean, I just started working on this because of. Will was in Japan last year, and we talked about this educational differences, and I started looking at 2 longitudinal studies available in Japan. And those two, using those 2 longitudinal studies, that now I'm just focusing on education. Well, so the Japan is life expectancy at birth is increasing quite a lot. Although the now it's not the #1 in the world, so even for females it's number 2. And I don't know whether we can keep up with those high life expectancy country in the world, but we'll see. And for men, it's 5th or 6th, so it's not the highest life expectancy.